thank you guys that are on here virtually and also here live with us. This is Dr. Raina. If you don't know her, she is your health coach. Your doctor, right? The Yancey doctor. So if you do need a primary care doctor, hopefully she'll offer her services to you. But she's going to talk to us a little bit about prediabetes and diabetes for this nationally recognized month as prediabetes month. So I'm going to let her take the floor and step away.
So I'm Dr. Raina. I work at Pearl Primary Care, which is a service offered to you guys by Yancey. It is part of your covered plan. And I'm happy to see anyone who wants to come see me. I love talking about diabetes and prediabetes. I'm sorry. I apologize if I bore you all to pieces, but I tried to keep this as like reasonably short as possible. Is this meeting something that you guys do on the regular, or is this a special occasion, Brittany? Okay, special occasion. I thought we're sitting back there and I was like, all these ladies here, what's going on? This is fun. I got to get in on this meeting regularly. So I'll go through this presentation. This is a Prezi presentation. I apologize if it's a little busy. If you get vertigo, just close your eyes. We'll get through it. Okay. So go again, talking about prediabetes and diabetes. I didn't focus just on prediabetes simply because once we're at prediabetes, we're like on the cusp of diabetes. So I figured we'd talk about both at the same time. So risk factors of diabetes. Everybody knows that if your mama had diabetes and your grandma had diabetes and your great grandma had diabetes and your dad had diabetes and your brother has diabetes, you potentially will develop diabetes. A family history is a good indicator for what you may get in life in general. If your mama has brown hair and your daddy has brown hair, then you probably will get a shade of brown. It is just how our genetics work. So family history is a huge predisposing factor for diabetes, simply because your family of origin, that's where you learn to eat. That's where you learn to exercise. That's where you learn how to manage your stress. That's where you learn how to manage your weight. All those things that you've learned throughout your life that go with you from the time you're a baby up until the time you die. So family history is hugely important. Overweight, obesity is also a large risk factor for diabetes. So that's anybody who has a BMI greater than or equal to 25. So we look at BMI as your height and your weight in a equation, and then we spit out a number and say, oh, it's 23, oh, it's 34, oh, it's 47, any number of things. But if it's greater than or equal to 25 in most people, if you're Asian American, it's greater than or equal to 23. So the Asian population gets a little bit tighter BMI control for risk factors. Other medical problems, so having high blood pressure can predispose you to diabetes. Having some mental health disorders that require you to take special medications can put you at risk of prediabetes. If you have a medical condition such as lupus or rheumatoid arthritis or something like that, where you have to take steroids regularly, that can also predispose you to diabetes. Increasing age, so anybody over the age of 45 has an increased risk of diabetes. Physical inactivity, so if you tend to not move a lot from your whole life, or you were really active in high school and you played all the sports, and then suddenly after you got your job, you became very sedentary. That change in physical activity can really predispose you to diabetes. Other things, especially with ladies in here, gestational diabetes. So having diabetes during pregnancy predisposes you to having diabetes later in life. Polycystic ovarian syndrome. So PCOS is kind of the trendy thing now. If you had that as a younger woman or a teen, or even throughout your life, you're more predisposed to diabetes because those put you in a category of insulin resistance. Some of the other risk factors are having elevated cholesterol, having fatty liver disease, having something called acanthosis nigricans, which is darker spots, usually on your neck, your waistband, your underarms, those spaces where your clothing rubs, you can get darker spots. Those demonstrate an increased risk for diabetes later on. So some of the things we'll talk about are insulin resistance, metabolic syndrome, fasting glucose that's elevated, and an elevated hemoglobin A1C. And I will explain all these things. If you have any questions, please feel free to raise your hand and ask. And if you have questions at the end, I'll be sitting in the back and you can come and talk to me as well. So insulin resistance, over time, our bodies become resistant to insulin. Insulin is a hormone our bodies secrete in response to what we eat. And there's the 8 pathways that we have, and I'm sorry, I'm going to move from right here so I can kind of point. This is called, it's going to blow your minds. Revolutionary picture about 10 years ago. It's called the ominous octet. So insulin works in 8 pathways in our body. It works in our brain. It works in our pancreas where insulin is produced. It works in our liver. It works in our muscles. It works in our kidneys. It works in our intestines, and it works in our fat cells. I know that sounds like 7, but the pancreas gets 2. It's special because that's where insulin is made. So the ominous octet, when your insulin stops working as well, that's the hormone in your body, then your body can't respond appropriately to the signals that it's being sent. So you eat, your pancreas sees you've eaten, and it sends out insulin. Your body's supposed to absorb appropriately, but eventually it just can't do it anymore. So it's not responding to what the signals that you're sending out. And so you become resistant. And so your body sends out extra insulin and then extra insulin and then extra insulin. And eventually your internal insulin, your body doesn't respond to anymore. And so then you develop diabetes. This is type 2 diabetes. It's very different than type 1 diabetes. And I assume that none of us in here have type 1 diabetes because I haven't met you yet. And we would have met if you had that. So type 2 diabetes is the adult onset. It is an insulin resistant problem. Type 1 diabetes is when your pancreas, your body kills it in an autoimmune fashion. So it doesn't work anymore. Very different than this. So that insulin resistance plays a role in all of your body systems. So people with prediabetes may not think as clearly as they used to think because their body's not responding to that insulin hormone in their brain. The sugar that you need isn't getting to your brain the way it should, so you can't respond the way that you should. When you work out, you're not getting the sugar to your muscles, so you might get more tired than you would have gotten previously. You're not taking sugar up appropriately in your kidneys, and so then you're getting sugar spilling over into your urine, which can make you get more bladder infections or yeast infections or any number of things. And your fat cells, those lovely jokers, they respond to all the insulin. So they're like, ooh, I love insulin. Let me take up all the fat bits. And then they suck in all of your insulin, and then you get bigger fat cells. And fat cells have a capacity to grow infinitely. Unfortunately, I wish they didn't. So they will get as big as they want, and they will never hit a capacity. So it ends up that you end up storing the sugar that you should be getting rid of if your body was responding appropriately to insulin. So you see, it kind of is a vicious cycle. It's not one thing or another. It's multiple interactions in your body not responding to this hormone appropriately. So most people develop what's called metabolic syndrome. And this is a syndrome that has developed over time where we see people have high blood sugar fasting or after eating. They have a low HDL, and HDL is part of your cholesterol panel. When you got your screening test done here at Yancey, they gave you a full lipid profile, and it had your LDL and your HDL and your triglycerides and your total cholesterol. A low HDL, this is your good cholesterol. It's the one that's cardioprotective. It helps protect your heart. It helps protect your brain. And if you have a low HDL, that is less protective for your body and is part of metabolic syndrome. Another indicator is high triglycerides. Those are the part of the cholesterol that's affected most by carbohydrate intake, and then a large waist circumference. So I remember reading a lot of women's magazines, and that's kind of that apple figure or pear figure. So people who have a larger waist circumference, and then higher blood pressure is another indicator for metabolic syndrome. So it's usually a 3-pronged thing. It's high blood sugar, elevated cholesterol, and high blood pressure. So looking at those things, this is where we stop prediabetes when we see metabolic syndrome. We say, oh, let's stop here. But oftentimes people don't catch it this early. They know that something's going wrong. They're not sure what it is. They go to their doctor. They've been told they have high blood pressure. They're trying to lose weight, but they can't because we saw that the insulin's putting all that sugar into the fat cells. It's not responding the way it should. So you're trying your best to lose weight. You're trying your best to get your cholesterol controlled like your doctor said, but you're just stuck. You can't do it anymore. So when we start talking about prediabetes, that's this elevated fasting blood sugar. This is our indicators for prediabetes. So when we check your blood at the doctor's office, we usually get a blood sugar or a hemoglobin A1C, which is what's called hemoglobin is the red blood cells, the cells in your body that take oxygen. And those cells are affected very strongly by sugar in your body. And so we measure those cells, the amount of sugar they've taken up over 3 months period. And that's where you get your hemoglobin A1C. And then your fasting blood sugar is what you've got just if you haven't eaten in the last 8 hours, what your sugar would be. And then there is something called a 2-hour glucose tolerance test. If you've had babies, you had to drink that yucky stuff and you sit there for an hour and then take your blood sugar. This one is a 2-hour test. It's a little bit longer. They make you drink more of the yucky stuff than you would have ordinarily had to drink. And you sit there and then they check your blood sugar. That is done less commonly and more of as a confirmatory test. If somebody has a problem with hypoglycemia, meaning their sugar goes super low really fast, then we would be more apt to do that 2-hour glucose tolerance test. But if your A1C is between 5.7 and 6.4, that's prediabetes. That means that on average, your blood sugar has been above 100. So 100 is kind of the cutoff for normal. If it's above 100, then we say, look, your sugar's a little high. We need to work on this. So on average, your blood sugar's been between 100 and 125 over the last 3 months. You have a fasting blood sugar of 100 to 125, or we do that 2-hour test. We'd only do that 2-hour test if we can't figure it out. If we're talking about diabetes, it is above those numbers. So prediabetes is in the middle, and then diabetes is anything above. So a hemoglobin A1C, a sugar over 3 months that's 6.5 or higher, meaning your blood sugar over 3 months is averaged higher than 125. A fasting blood sugar of 126, a 2-hour test of 200, or any random test. So you've come in and you've had whatever to eat that day or nothing or however, whatever. If your blood sugar is over 200, we go, that's probably not okay. We probably should check this a little bit closer. None of these by themselves is confirmatory. We have to do 2 tests. So either we get your fasting blood sugar and a hemoglobin A1C, we get your hemoglobin A1C, and then we bring you back in 2 or 3 days and get your fasting sugar or another hemoglobin A1C. But we have to check. I'm never going to give you a diagnosis off of one reading. Like, oh gosh, this is horrible. We got to get this figured out. I give you, come back and we'll check it and figure out what's going on so there's not any confusion. So we want to prevent prediabetes. Everybody understand now what prediabetes is? Kind of got a general idea about how it works and how insulin interacts in the body kind of thing. So the biggest things that we can do to prevent prediabetes and diabetes, you can't prevent your family of origin. Sorry, you're here. You can't make your mom and dad's history go away. You can't make your siblings' history go away. You can't change your ethnicity. You can't change your age as much as we would love to. You can't change your history. So if you had PCOS, you can't suddenly make that be gone in your history. You can't change that you had diabetes when you were pregnant. But you can change your activity level, you can change your diet, and you can change your cholesterol and your high blood pressure. So there are some things that you can change. So we say dietary changes. Everybody kind of knows that if you get diabetes, you can't eat sugar anymore. We get it. Like, all right, fine, you can't have sugar. But there are some other things that you can do to prevent it prior to developing prediabetes. So carbohydrates have been very in vogue to talk about for the last 10 or so years, the Atkins diet, the keto diet, those sorts of things that people do. But we need sustainable, maintainable dietary changes. So if you cut all carbs out of your life, you will eventually become kind of grumpy, and you may not be the most fun person to be around. And 3 years later, you're going to be irritated still, and you may not be at the weight that you want to be. But if you cut what I usually tell people is cut white foods out, white bread, white rice, white pasta, white potatoes, and change those with brown foods, brown rice, sweet potatoes, whole grain pastas, veggie pastas. So you're still getting carbohydrates. You're still getting that taste, that flavor that we all crave and need. You need every part of your diet, but you're not getting so much of it. And you're not getting such processed foods. Activity changes, those are easier than we think. Sometimes, well, how about this? Research has shown that in America, we tend to sit more than we move, which is okay. But even just getting up and moving for 2 minutes an hour can change your metabolism. So most everybody has a smartwatch. Most everybody has a way that they can set a timer. Getting up and moving 250 steps, getting up and doing 4 squats to get your blood moving, getting up and walking around your office 1 time every hour. Those tiny activity changes as you're cooking dinner, you sit on this is what I do because I get bored with cooking. I sit on my counter and then I do little push-ups, like just to move just a little bit. Or I take my cans because I'm not the greatest cook and I use a lot of canned goods. And I lift my cans over my head before I open them up 10 times. And then I open my cans and I get them. Those tiny activity changes can be huge for people who in general are fairly sedentary, which is the vast majority of the American population. I'm not asking people to go out and run a 5K. I don't care. You don't have to run a 5K. That's not for most people. But walking around your house 3 times before you sit down to enjoy your show at the end of the evening. As you're folding your clothes, lifting your knees up. Okay. So just small things that you can do to change your activities. The other lifestyle change that we can do is medication to prevent progression. So that is medication to help control blood pressure, medication to help get your cholesterol normal, and medication to prevent your blood sugar from staying high by getting your body to respond to that insulin that you already have there. Any questions so far? So the good and the bad. Good things, strength training, especially in women, guys, this is so important because we have so many risk factors for things like osteoporosis and developing dementia and things that can totally prevented by strength training and cardiovascular exercise. So again, I'm not asking you to go run a 5K. I'm asking you to do body weight exercises. Do push-ups on your wall when you're putting your makeup on. If you're blow drying your hair, take one arm and blow dry your hair and use the other arm to just bend against the wall. Again, do it in moderation and don't fall down or slip in the bathroom or something crazy. But if you are cooking dinner, march in place while you're stirring the pot. If you're getting ready to drive home for the day, in the car, dance. I know it sounds ridiculous and people will look at you in traffic. I don't care. Turn on your favorite song and big dance in your car on the way home. Okay. You've got these little tiny things can increase your lifespan. Weight loss, a 10% weight loss in someone whose BMI is greater than 25 is considered excellent. So if you weigh 185 pounds, then losing 18 pounds can put your health back to a normal range. It doesn't get your BMI to normal unless you're, 5'10", but it can increase your lifespan just by that small loss. And most of us can deal with that, cyclical 5 to 10 pounds that you get every 2 months. Like my weight is usually this to this. That's normal, but we want to reset your baseline. So if your baseline is usually 200, we want to reset your baseline to 190 or 180 so that you can fluctuate between 180 and 190 or between 190 and 200, kind of give you a better baseline. We want to decrease sugars in your diet. So that means any added sugar. You'd be surprised reading labels how much sugar is in things because we crave sugar. We just do. There's nothing wrong with that. It's not inherently evil. Sugar in and of itself is not bad, but decreasing what you will tolerate. So, if you make your coffee in the morning, consider decreasing the amount of sugar that you put in your coffee. If you use artificial creamers, consider getting the ones that aren't flavored or getting ones that are dairy instead of the cornstarch artificial creamers. Decreasing our processed foods if you eat food that looks like it's what it's supposed to be, right? So I have got an apple. It looks like an apple. I eat an apple. I have got applesauce. It looks like an apple. It tastes like an apple, but now I've got apple jerky that's been made into a strip and looks like a fruit roll up. That's not an apple. We know that a fruit roll up is not an apple, even if it's apple flavored. Even if it has an apple on the label, it's still not an apple. So the things like lean cuisines or frozen meals, while they're quick, while they're easy, while they have fewer calories, they're not as good for us as making your own chicken breasts twice a week, making 4 of them, popping them in the freezer and popping them out with some mixed vegetables that you've popped in the microwave. Same ease, but decreased additives and decreased problems with your health. Physical inactivity, again, that's not great. Sugary beverages, and a lot of people, I am also not great with this. I love sweet tea, and I will go to Chick-fil-A every day and get a sweet tea. But I recently had an elevated hemoglobin A1C to the point that I went, I probably shouldn't do this anymore. And I cut sweet tea out, and mine went from 5.5 to 5.2, just cutting out sweet tea, which was huge for me because I love sweet tea. I grew up in South Georgia. Like that is, mother's milk to me, but I knew I had to cut it out and it wasn't good for me. Artificial sweeteners, while we love them and they seem like they're going to help us, artificial sweeteners send a message to your brain that you are getting sugar and you don't get sugar. So the next time you get sugar, your body holds on to it more than it would otherwise. So I would rather you drink a real Coke than a Diet Coke. I would rather you drink real sweet tea than fake sweet tea. I know it sounds bad. It sounds so counterintuitive, but the way that your body reacts to artificial sweeteners is not great. So if you can cut out sugary beverages and artificial sweeteners and just drink water or coffee or plain tea, please, Jesus, don't say that, but something else, then that is better for you than drinking. It's just their hidden calories and you don't realize what you're getting. It's like drinking a milkshake from, again, Chick-fil-A, my love Chick-fil-A, but you will get 2,000 calories in a strawberry milkshake from Chick-fil-A that you drank down. And that's not even a meal. That was just a little snack. Like you can't do that. You got to think about what you're doing and be mindful. So that's prevention. So treatment, I'm going to kind of breeze through this because this is something that if you want to come talk to me, I'm happy to talk to you for an hour about this if you'd like. So medications can be used for prediabetes. They can be used for weight loss. The oldest medication we have is insulin, which was a life changer. People stopped dying from diabetes when we got insulin. But the oldest one is insulin. The next one is that metformin one that's in the corner here on the right. And that is, you can use it. That's a pill, right? So I'm like, that's your first line. If you got PCOS, we give you metformin. If you got prediabetes, we give you metformin. It helps your body recognize the insulin that you're making so that your pancreas doesn't go. It makes it work. Okay. The DPP-4 inhibitors, those are, you've probably seen it on TV or written down, Januvia, the Janumet kind of thing. It can increase weight loss. It can increase that sensitivity to your own insulin. SGLT2 inhibitors, those are Jardiance and, gosh, I'm going to blow through the names, but the ones you see advertised, those are also pills. The last one, GLP-1 agonists, those are your shots. Ozempic, Wegovy, Victoza. Those medications are ones that we use in conjunction with weight loss therapies to try to help people get their sugars under control and lose weight. So also good medication options. So I know that there's a lot of help for weight loss in the lay public, but I believe Yancey has a program for gym memberships and trying to get people in to exercise. And you ladies are all here together. Find a partner, get accountable to each other, work out, go for a walk at lunch. judge each other's food. Like, just do whatever you need to do to try to get each other held accountable. Medications, I am happy to help you in any way that I can. You come see me, we can get you on a regimen that works. And I'm not talking about just like Fen from the 80s. That's not great, but like real things that actually work and maintain weight loss over time and won't kill you. Accountability is huge. That can be just you and your friend. It can be you and your spouse. It can be you and your mom. It can be you and somebody you met online on a Facebook group. It can be you and me. I am happy to have you come into my clinic every week and get weighed and look at me in the face and tell me what you ate and bring me pictures. It can be joining Weight Watchers, which is the only evidence-based weight loss program that we know works over time. And it works over time because you have to go in and look at your coach and be like, here is what I ate this week, and step on the scale in front of God and everybody. And you have to be accountable, but we know that accountability works. That's why, working in an environment where you come into work, you're here, you have to focus. You can't be, scrolling on Facebook when you're at work. So you've got accountability. Yes.
Question in the chat.
Okay.
There are no artificial sweeteners that are good, like stevia. Yes. The question is, Steve, how do you feel about stevia? And I don't know if they can do it.
So stevia is an alternative. It will help if you are an insulin dependent diabetic. Then we've got all kind of different options. It is more natural than something like aspartame. It is not ideal simply because it is a processed thing, but I would prefer you have stevia than have aspartame. I would prefer you to figure out a way that we can eliminate the things or cut them back. Again, I'm not telling people they have to have nothing and things that they enjoy are not good, or you can't do half and half to make things tolerable. But decreasing the amount that you would take in on a regular basis would be my recommendation. Okay.
Should I have sugar rather than stevia in my?
I mean, would you like to consider doing black or just with cream? That would be my recommendation. But stevia is fine in coffee as long as you're not doing 2 or 3 packets. If you do 1 packet of stevia in your coffee every day, that's fine. It's learning. We have to train ourselves to not go to Starbucks and get the mocha frappuccino latte yumminess that they have, because that thing, even if you put stevia in it, there's so much stuff in there that it's just not good for you. If you're making your coffee at home and you put a spoonful of stevia, go for it, do it. But if we're talking about replacing that, I have made cookies and instead of using any sugar, I have put all stevia in here and now we're all going to go out and have this. That's not ideal either. Just maybe eat 1 cookie instead of 5 cookies, which I will eat a whole sleeve of Oreos. I promise. Like, it is what we do, and there's no shame in it. It's more the accountability and knowing what you're doing. So does that answer the question? Potentially. I'll move on until you tell me. Okay, perfect. So our goals. One is prevention. We talked about this kind of ad nauseum. I'm sorry if it was very boring, but prevention is way easier than treatment. So if we start seeing it creep up, like I said with me and the dang sweet tea, I started seeing my A1C creep up over time and I went, I can't do this. I need to cut it out. So I cut it out, and because it was a problem, it was every day I was going to Chick-fil-A and it needed to go. So, but the prevention is far better than treatment, and prevention can be changing your diet. It can be changing your physical activity. It can be adding medications, but we're not treating, we're preventing. Again, a second goal is treatment. If you know you have diabetes or prediabetes, don't be afraid of doing something for it. It is a disease. It progresses over time. So if you think, I have done everything that I can do, I have changed my diet, I have changed my lifestyle, I have, done the medication, but it's still progressing. I don't understand. I don't know what I'm doing. You're not doing anything wrong. It's just your body is saying, okay, I've done the best I can do. Now we'll let modern medicine take over. So you get the treatments that you need. If you have high blood pressure, don't feel like if I go out and run a 5K every day, I'm going to get my blood pressure under control. That doesn't work for everybody. Some people just have high blood pressure. Your mama had high blood pressure. Your daddy had high blood pressure. Your grandparents had it. We have to treat that. And even though you do everything correct, you may still have that disease. It's not anything wrong with you. It is not a shameful thing. It is just something we need to treat. We need to take care of. So don't feel like, oh gosh, now I've got high cholesterol and I'm going to go in there and Dr. Raina is going to tell me to quit having this and quit having that. Look, I'm great, quit. And if you don't want to quit, then we can fix it. It's like, if you don't want to quit smoking, I can't make you quit smoking. But if you do want to quit smoking, I can help you the best that I can. And we know that over time you may relapse or you may not. It just is what it is. And life isn't always black and white and easy and hard. It has a nice spectrum. So get the treatment that you need. Keeping your numbers in check. So making sure that if you have prediabetes or diabetes or struggle with high blood pressure or struggle with high cholesterol or overweight, obesity, keeping those numbers so you know your data, you know where you are. You know that your hemoglobin A1C is 6.2 and I need to keep an eye on it. And if I keep it at 6.2, great, like that's a win. But if it starts creeping up to 6.4, then we need to change some things. But if you don't know, then how can you fix it? I will say that this is a little bit negative, but I'll say it anyways. One of the risk factors for diabetes is being male. And the reason we think that one of the risk factors for getting diabetes as a male is because they don't go to the doctor. So they don't get things checked on earlier so that we can fix it in the prevention phase versus the treatment phase. So talk to your significant others, talk to your brothers, your father, your coworkers, tell them to go get checked on, and make sure things are okay. That's why we do the screening program at Yancey. But I mean, if you have friends and family that don't work at Yancey, tell them to go to their doctor and get checked on to make sure things are okay, especially if you know they have a family history or they've got some of these predisposing factors. One of the goals is to prevent secondary illnesses. So again, that metabolic syndrome, we want to prevent you from having a stroke. We want to prevent you from having a heart attack. We want to prevent you from developing breast cancer and any number of autoimmune diseases that can develop with diabetes. So we try to treat it beforehand when it's in the pre-diabetic phase and try to treat it when you have it so nothing else progresses along with it. Does that make sense? Okay. And that is all I have to say.